Hi everyone, it's Dr. Wendy Fortna here on Wednesday, December 9th with a COVID-19 update for Special Areas 2, Hanna and area. I am sad to report that our numbers have decreased in Hanna, and not because somebody has recovered, but because one of our COVID-19 patients has died. We will keep him and his family in our thoughts and prayers moving forward, and it serves as a good reminder for all of us that it is not a benign disease, and people that we know and love could possibly be permanently injured or die from COVID-19 infections. So right now we have 8 active cases. Some of you may also be aware that the Hanna Long-Term Care Facility is under outbreak. At this point in time, there are no residents who are sick or are positive, but we do have a staff member who is COVID-19 positive. We are making many changes right now in our facility to ensure that this staff member is healthy and well and that nobody else has been exposed to the disease. You may be aware, if you go up to the hospital, that if you are not one of the single essential visitors for a current long-term care resident, you will not be able to visit that individual at this time and for the duration of the outbreak. We continue to have 2 essential visitors allowed for each inpatient on the acute care side of the facility, and our emergency department, x-ray department, and lab department are functioning as normal. As well, physiotherapy as of today is still doing their outpatients. So if you have an appointment booked with physio, you'll still be able to access that appointment. Our medical clinic is still fully operational. We have no sick or off work staff members at this time. So we are able to welcome you for your scheduled appointments. Some of you may be nervous and want to cancel your appointments, and if you truly feel that your health issue is not urgent, that is always going to be an option for you. But if you're uncertain, please talk to your physician about it so we can help you decide whether or not that health issue needs to be dealt with now or if it can be put off. I have received a record number of questions this week. I'm going to try to get through all 8 of them, but I'm not going to read the questions in their entirety and see if I can simply summarize the situation. The first question was about something called the Great Barrington Declaration, I guess a piece put out from a number of healthcare providers and administrators asking people to support a zero lockdown freedom application. And I was asked if I would agree with that, whether I would sign it, and why or why not. And I think that if you talk to almost every single caregiver who has been involved with a COVID patient, they would tell you that some type of restrictions are necessary. There's nothing like the feeling of standing outside the room of someone who can't breathe, terrified as you go into that room that you're not going to put on your equipment correctly. You might contaminate yourself or your loved ones, but at the same time feeling that need to go in there and support that patient. Watching how rapidly this disease can cause a patient to go from breathing on their own to needing to be intubated to crashing. It's almost indescribable. So no, I would not sign this. And that's because I've stared COVID in the face in my patients, and I am scared of it. And I hope that the vast majority of people in our community take it seriously and are scared of it too. If we're lucky enough to know people who have had minor infections and have recovered, then we can consider ourselves blessed. But I've had both spectrums, all the way down the minor and recovered, and the severe patients that I've had to call stars for and transfer them out of our hospital on an emergent basis. And now we've lost a patient. So I wouldn't sign it. The next question was about treatment of the disease. Am I aware of the use of hydroxychloroquine, zinc, and azithromycin as a treatment? So one of my favorite resources for learning about what's going on with COVID right now is called Emergency Medicine Reviews and Perspectives. They have a wonderful physician focused resource where they will summarize current articles and studies going on. It is accessible to the public, but I don't generally recommend that most public read it because it's not written for a layperson. If the individual asking this question is interested, or someone might have a healthcare background, they can access Emergency Medicine Reviews and Perspectives COVID-19 chapter, and they can learn a lot of the current information. I looked specifically at those things, and there are ongoing trials under most medications or treatments right now. Azithromycin has some role, which is an antibiotic for those of you not familiar, if people not just experience COVID infections, but also experience a bacterial pneumonia or other bacterial infection on top of the COVID infection. Steroids are being used fairly commonly to help decrease inflammation in COVID patients. The use of hydroxychloroquine in more studies has been proven to be harmful to patients, and so we are not using that routinely at this time. I know that we have ups and downs and things change, but right now we're not using hydroxychloroquine. And there was, I believe, an observational, not yet peer-reviewed study outside of New York talking about the use of zinc. So there just isn't enough firm data to know whether or not we're going to start doing that. I do not want a whole bunch of people to go out and buy zinc, because often if we're taking too many minerals and vitamins in quantities that we're unfamiliar with or unprepared for, we can cause other problems. So right now in Canada, we are not using zinc to treat COVID infections. The next one. So somebody thought they had COVID in the winter time but couldn't get out for testing, and they're wondering now that they're well if there's any possibility of donating their serum, part of their blood that maybe has antibodies, to help those that are sick. I think it's a wonderful gesture, but again, we go back to the studies. If we use plasma from people who have recovered, we actually haven't shown a great deal of benefit in sick patients. So number one, we would only be able to do that in people with confirmed infections who have recovered, and it would be part of a study system. And there isn't one that I'm aware of that you can donate plasma to. And while there is the ability to test people to find out if they have had COVID infections, it's not universally available in Alberta. I, as a family physician, cannot request it. I suspect right now it's restricted to infectious disease specialists. So I would say thank you for your thoughts, but not an option at this time. Cohorts and single people. So Dr. Hinshaw did a really nice explanation about how this works. So if I live on my own in an apartment, in a home, I don't have a significant other or children with me, I would have the choice of having two other individuals that form an in-person cohort with me that I could socialize with without masks, without violating any public health orders. If these two people that I have chosen are single as well, and they have chosen us as a group of three to be together, then we could socialize in each other's homes. If those people that I have chosen might have families of their own or be part of other cohorts, say other individuals that they've formed a chain with, then I cannot go and visit them in their homes, but those two individuals could come and visit me in my home. I hope that clears that up a little bit for you. Next up, what do I do about businesses who are not following the rules? Number one, you don't go there. Number two, you can report them. If you take a look at my video from last week, you'll see the phone number that's there to report a business that isn't following the regulations. This question came before the announcement this week. So as you know, there has been many changes over the next 4 weeks that we're going to be dealing with business-wise. I think it's going to be very difficult for businesses to not comply with these new rules. So hopefully we're not going to have a lot of situations where we need to be reporting people. The next one wants to know, I provide day home care for my grandchildren. Can I have my grandchildren and my children over for a family meal? The answer is no. And I realize that seems a little funny right away. But having your grandchildren in your home while you're watching them as a child care provider is very different than having a dinner party with adults. We know that adults are more likely to spread COVID-19, more likely to get severe infections. And so to bring adults into your home, you're going to expose two other people or more that may not have been exposed through their children secondarily. So especially with the new regulations on board, there are no social gatherings inside of homes or outside of homes. So there should be no dinner parties, whether part of your day home is providing care for your children or not. I think that that is actually the end of my list today. I'll finish with a little bit of good news, which is we're starting to get those vaccines arriving in Canada. And so a number of healthcare workers and vulnerable populations will be at the top of the list for those vaccinations coming through, so that we can continue to be here to provide care and support for you. So please stay healthy and well, and I'll give you another update as soon as I have more to share. Thank you.